our doctor medicine തരാൻ അയാൾക്ക് കമ്മീഷൻ കിട്ടാനായിരിക്കും. He's doing this for his own personal interest and things like. This has to change.
ഫോർ എക്സാമ്പിൾ ഒരു ആശാരിയുടെ മകനെ ആശാരി ആക്കാൻ നോക്കും. ആൻഡ് ഹി വിൽ വോണ്ട് ദ മകൻ ടു ബി ഈവൻ ബെറ്റർ. എന്നെക്കാളും നല്ലൊരു ആശാരി ആവണം. ഗവൺമെന്റ് ഓഫീസിൽ ഇരിക്കുന്ന ആൾക്ക് എൻ്റെ മകന് ഒന്നുമില്ലെങ്കിൽ ഈ ജോലി ഇതിനേക്കാളും എൻ്റെ സാറാണ് ആ AS ആക്കാൻ നോക്കും.
Colleges like every day 10-100 patients ഉണ്ടാവും. Right. It's just പെട്ടെന്ന് കണ്ടു തീർക്കും. There's no real ഒരു human approach ഭയങ്കര കുറവാ. And the nurse called me and told me and I have to go and declare the death. First time. I've never done that before. Nobody has ever told me how to do it. Okay. Doctors are the worst patients. That is also there. Your mom being a gynecologist.
അമ്മയുടെ അടുത്ത് അമ്മയ്ക്ക് എന്തെങ്കിലും അസുഖങ്ങൾ പറയുമ്പോൾ അമ്മയ്ക്ക് പിന്നെ എല്ലാം അറിയാലോ, അപ്പോൾ കുഴപ്പമില്ല. അപ്പോൾ ഏതെങ്കിലും ഡോക്ടർ കൺസൾട്ട് ചെയ്ത് അവർക്കൊന്നും അറിയാം, അത് തെറ്റാ. അമ്മയ്ക്ക് പിന്നെ എല്ലാം അറിയാലോ, കുഴപ്പമില്ല. Hello everyone and welcome to another episode of the Millennial Comrade. My guest for today is Dr. George Paul, one of the leading gynec surgeons in Cochin and the medical director of Paul's Hospital. Welcome, doctor.
Thank you, Deepak.
Should I call you doctor? Should I call you George? George. Yeah. We've been planning this for a while. We just finally got around to doing this.
Yeah, I got delayed last time.
Yeah, happens. I fell sick. Then you were traveling. Yeah. You travel quite a bit.
Yeah, lately a lot.
Why off late? I mean,
nothing. I mean, a lot of things came up. Work. Some travelers are sorry with work, and then the family and everything all together. But yeah, I enjoy that.
Yeah, but I think that's one of the perks of being in the medical field. You guys actually do travel quite a bit.
In the name of conferences.
Right.
Yes. Yeah,
okay.
So we do. But yeah, but it depends again. Because I'm working with my father, we have at least there's somebody to look after the place, then we have the leeway to travel.
Yeah, I suppose.
Otherwise, it's difficult.
Okay. Every day last way, Vietnam.
Yeah.
Okay.
Ho Chi Minh and Mune. Yeah.
Okay. Liked it. Good place?
Good place, but it was hot. Worse than
കാശ് എടുത്ത് അവിടെ പോയി അവിടെ വെയിലും.
സ്വന്തം നാട്ടിൽ നമ്മൾ ഇറങ്ങി നടക്കില്ല വെയിൽ.
Nice. Yeah. So how long has it been? ഇപ്പോൾ ഇവിടെ കൊച്ചിയിൽ വന്നിട്ട് have you been practicing?
So I think after my post graduation I came back directly. I think in 2016 end. So
16
end. About 7.
Okay. Nice.
It's been some time, yeah.
അതിനു മുമ്പ് you were, I mean, I didn't run through your resume first of all, because it's a huge resume. Your qualification and the number of places you have studied. So if you want to run through your resume, you can do that right now. Like where all have you studied? France, Belgium.
Those are just small courses, nothing big. So basically, I'm born and brought up in Cochin. I did my schooling in Bhavans in Chinmaya.
Right.
Did my MBBS in Pushpagiri Medical College in Tiruvalla.
Right.
After that, I did my MS in OB-GYN in Pondicherry Institute of Medical Science. And after that, I came back. My dad is a gynec lab surgeon. So been with him, been training with him, studying, working, everything all together. Been doing that. And in between, I've undergone some basic training in Belgium.
Okay.
For this laparoscopic surgery. And then lately, last year actually, I went to Bordeaux in France for some advanced techniques, to learn some advanced techniques in laparoscopic surgery.
Okay. Oh, damn. That's
here and there, I've done small.
Okay. Are you doing surgeries in any other hospitals right now, or just at Paul's?
So right now, my hospital, and then I go to specialist hospital as well.
Okay.
I have an OP and OP. I operate there as well.
Okay.
And then I go and do freelance surgeries in few other hospitals in and around Cochin.
Okay. Well, that's nice.
It takes a lot of effort to build up your own practice. So
yeah, but then again, see, you can only do that. I've seen that with a lot of doctors, especially surgeons, like male surgeons. It's one of the things I've observed, especially with male surgeons, is the fact that this is the age when they are young. I've seen them run from pillar to post, like from north to south. Some of them even flying across the country, everywhere. Right now it's just building that brand value, I suppose.
Absolutely. I have seen my dad do the same.
Yeah.
So we started a hospital in 2003.
Right.
Until then, his main place there was a hospital called Vijaya Hospital, North Railway Station.
Yeah.
So he used to be mainly working there.
Okay.
And then he used to go all around in Cochin. He used to go to Erode and Salem as well to operate. I think once a month. And in Trivandrum as well.
Okay.
So seeing all that, I mean, I think it's pretty much normal for me to do the same thing.
Yeah.
Even others, lot of other like gynecologists I know, orthopedicians running around the city operating. I think most of the surgeons, like you said, not just male surgeons, in fact. There's another slightly more senior female gynecologist. I mean, wherever I've inquired, and she's the one who's already always going out to all these places.
Okay.
So I think respective gender surgeons
Okay.
as such has to
Have to do it.
do that. Yeah.
Yeah, but that's one of the things that separates the physicians from the surgeons, right? The fact that, and most of the surgeons I've interacted with, they hate sitting in the OP.
Absolutely.
They hate the OP. They don't like the crunching and the paperwork or the consulting part of it.
Physical work, that gives us satisfaction.
You must have absorbed this from your dad while growing up, right? ഇത് കണ്ടല്ലേ വളർന്നേ? I mean, അത് കാരണം കൊണ്ട്, is that why you got into medicine or?
Basically, പറഞ്ഞ പോലെ, grown up watching him
Right.
go around, operate, and so one of my main exposure to his surgeries when he comes home and edits videos. So you don't have a laptop and all that. VHS tape.
Okay.
You've got a VCR recording.
Okay.
So I'm the one who has to note down the timing.
Wow. Okay. That is.
And do all that. So I've watched a lot of these videos. It's not like I understood any of that back then, but then it looked very fancy. It really intrigued me.
You weren't put off by the blood and the surgical videos, like laparoscopic video, camera point, some of you see a lot of the blood and the entrance and all that. So
not really. So only pictures of inside the abdomen.
Right.
So there isn't too much blood. I don't know. Maybe.
How old were you? When he got you like?
From a very young age. Probably from my kindergarten level onwards, I've done this. I remember it was in the house we were staying when I was in my kindergarten. Yeah.
Oh wow, that's.
I used to help him with the videos, and even later, until digital cameras came to being, you make the slides on the PowerPoint, and then with your regular SLR, you have to take a picture of the monitor.
Right.
Then you have to go to the studio, get it developed into films, and then that's what you carry to the conference.
Wow.
Film slides.
Right.
So I used to do all that. I used to prepare his PowerPoint. All these complicated words, it can months
Okay. Yeah. I mean, your dad is one of the OGs of lab surgery in Cochin. Like, even now, as far as training is concerned, Muttuke doctors, they cut their teeth with your dad at your center. And
he's one of the pioneers in.
Yeah, one of the pioneers. Yeah. But how is it like, now that you're working with him as well, like he's just dad/boss/mentor.
So, I mean, I think the advantage obviously is that I get to learn from the best.
Okay.
And I get a lot of exposure. Okay. We operate 5 days a week.
Okay.
Every day, at least 2 to 3 surgeries a day. So the sort of exposure that I get from here is probably you can't get it anywhere else.
Yeah, exactly.
So for a surgeon or for a doctor, for that matter, it's the number of cases that you see that really improves your skills and knowledge. That's a huge advantage. So as I've become more independent, there's a lot of clash of ideas during surgery.
Yeah. Is that a point of contention sometimes?
No, it's not a big problem, but yeah, not for the surgery part. When your family is running the hospital, there's a bigger clash of ideas. So my mom is also involved. She looks after the administration. My dad does both. So I'm also supposed to do all of this, and then if I come up with an idea, there'll be some objection or something or the other.
Yeah.
So there's a lot of what do you say, traction or friction between us. So like until I got married, I was staying with them as well after my college.
Okay.
So even before that, I was like, please, can I move out? I was like, you can move the place. So we've got a small studio apartment or a hospital compound. So it's like, I'll move there. It's like, no, it's not happening. The thing is, see, almost 10 years of medical school.
Right.
Staying in a hostel.
Yeah, you are used to your independence.
Exactly.
And suddenly when you come back, it can get a bit.
Step out like, yes. So even my wife, after we got married and we stayed with our parents for a few months, she was pretty much shocked. Like at our dinner table, we usually have dinner very late.
Okay.
So one thing, she's somebody who has a dinner by 7.
Okay.
So she's like half asleep, sitting there eating, and we are like sitting there and actively discussing about the hospital, about the patient. about some other problem, and
Right.
she's like, what is happening here?
Yeah. But I'm guessing I was going to ask you, like, even I face similar problems, like family setup aumbo, when you come home, that the our differentiation between work and home, it's a very blurred line, and there's always gets spilled over at work. Issue might
Usually,
it gets brought up.
With you on the same discussion continues.
Yeah, and especially if you're working in close quarters.
Yeah,
that definitely like
it's a problem.
every lunch and dinner is kind of like a board meeting.
Yeah, it's always a discussion about the hospital, something or the other. And since the last few years, there's some renovation or some work going on in the hospital. So,
Yeah, that's the thing. After X number of years, most establishments go through a constant renovation. And that is, it's a burden.
It's inevitable.
Yeah. But it's nice, like the fact that you are able to work with your dad and and view him, like I suppose that speaks to your maturity as well. View him as not just as your dad and as a mentor and in effect your boss.
Yeah.
In effect, you're your boss, and then strike that balance.
But the only problem is, so when it comes to, for the patients or for somebody looking at us from another perspective, there's always a comparison. That's one of the biggest.
Yeah. Absolutely. Does that get to you? How do you?
Yeah, I mean, after a certain point, yes.
I mean, downsides of nepotism. Satyam Barnanya, like when they say, like, and this is one of the things, like nepotism, as soon as you have an expectation. Exactly. Has a ceiling set for you. Yeah. It's like, Paul Doctor Paul Magananalo. It's expected now. It's like Sachin Magan. Poor guy, just let him be. Exactly. Let him live his life. Illa, Sachin Magan should be good in cricket. And that is expected. But that's the downside of nepotism.
No, absolutely. Our comparison is always there. So I remember one of our trainee doctors was talking about, Amitabh Bachchan and Abhishek Bachchan. I was like, oh shit. Already, രണ്ടുപേർക്കും ഹൈറ്റ് ഇല്ല.
അത് മാത്രമല്ല ആൾക്കാരെ നെപ്പറ്റിസിനെ പറ്റി കുറ്റം പറയുന്നുണ്ടല്ലോ. വൺ തിങ് വിച്ച് ഐ ഒബ്സർവ്ഡ് ഇസ് വി ഇന്ത്യൻസ്, മലയാളികളല്ലേ, ഇന്ത്യൻസ് ആസ് എ കൾച്ചർ വി ആർ നെപ്പറ്റിസം ഈസ് ഇൻഗ്രീൻഡ് ഇൻ അവർ കൾച്ചർ. എന്ന് വെച്ചാൽ ഫോർ എക്സാമ്പിൾ ഒരു ആശാരിയുടെ മകനെ ആശാരി ആക്കാൻ നോക്കും. ആൻഡ് ഹി വിൽ വാണ്ട് ദ മകൻ ടു ബി ഈവൻ ബെറ്റർ. അച്ഛനേക്കാൾ എന്നെക്കാളും നല്ലൊരു ആശാരി ആവണം. ഗവൺമെന്റ് ഓഫീസിൽ ഇരിക്കുന്ന ആൾക്ക് എന്റെ മകന് ഒന്നുമില്ലെങ്കിൽ ഈ ജോലി ഇതിൽ അല്ലെങ്കിൽ ഇതിനേക്കാളും എന്റെ സാറാണ്, ആ AS ആക്കാൻ നോക്കും. ഓക്കെ, സെയിം തിങ് ഡോക്ടറിന്റെ മകൻ എപ്പോഴും ഡോക്ടർ ആക്കാൻ നോക്കും. സംതിങ് ഇൻ സിമിലർ, ബിക്കോസ് ദാറ്റ് ഇസ് അവർക്ക് പരിചയമുള്ള ഒരു പ്രൊഫഷനാണ്. ഓക്കെ, സോ ദേ നോ വാട്ട് ടു ഡു ആൻഡ് നോട്ട് ടു ഡു അവർക്ക് അറിയാം. അപ്പോൾ ദേ വിൽ ട്രൈ ആൻഡ് യൂസ് ദെയർ ഗൈഡൻസ് ആൻഡ് ടു ഗെറ്റ് ദെയർ ചിൽഡ്രൻ ടു അനദർ ലെവൽ. ഇപ്പം US ആഫ്റ്റർ 18 യു ആർ ഔട്ട്, യു ആർ ഓൺ യുവർ ഓൺ, ഫിഗർ ഔട്ട് യുവർ ലൈഫ്. ഇവിടെ അങ്ങനെയല്ല. You're still with your parents. You're under their care to a good number of years. Like even after marriage, in big family setups, yeah, it's not like they're exactly under the parents' care, but there is still a significant parental influence. So nepotism, it is very much ingrained in our culture.
You get all these opportunities. It's
100%.
That's why it's probably one reason I took up the same stream as well, because I knew I wouldn't have to struggle the same way as others. There's an advantage in that. Opportunity unless you are good or unless you put in your hard work and develop your own skills.
Absolutely.
There's no way you're going to survive. So it's
a key. So it's a key that opens a door for you, and it's granted that it will, being the son of a person of influence, will definitely open the door for you a lot quicker than, say, if you're a stranger from the outside. You will get opportunities, but if you don't prove yourself, that door is going to close very soon. People will get tired. നാളെ ഇപ്പോൾ you guys are planning on expanding and you're getting outside investors, you get a private equity or a VC guy to come in. എല്ലാം നോക്കുമ്പോൾ your dad is there, ഡോക്ടർ പോൾ ഉണ്ട്, ഇതുണ്ട്, എല്ലാം ഉണ്ട്, സംഭവം ഉണ്ട്. മകൻ അത്ര നല്ലതല്ലെങ്കിൽ പതുക്കെ അവർ പറയും, yeah, you're out of this project. They don't care, they control, they do this.
It's numbers.
It's just numbers, that's it. So you have to prove yourself. മകനാണെന്ന് വെച്ചിട്ട്, that doesn't mean, I'm not saying there aren't people coasting through with that name. There are a lot of people.
But then finally your survival, if you want to survive, you have to make your own.
Exactly. Yeah, absolutely. Yeah. But it's true, there is a shadow when you step in.
Absolutely.
Moving out of that shadow is...
It comes with the package. I mean,
You can't have it all.
yeah.
You can't have it all.
നമ്മളെല്ലാം
Yeah.
ഇത് ചെയ്യാൻ പറ്റില്ലല്ലോ. It's definitely something that you have to accept.
So when you first came here,
Yeah.
like, you finished your courses and you're going to join the hospital with your dad, you would have had a certain enthusiasm, right? I mean, when
Yeah.
like, that I want to bring about certain changes or etc. Did you have any ambitions or anything of that sort?
Compared to what I saw in medical college.
Right.
Medical college is like, every day 100 patients ഉണ്ടാവും.
Right.
It's just, പെട്ടെന്ന് കണ്ടു തീർക്കും. There's no real ഒരു human approach ഭയങ്കര കുറവാ. So after I've come here, the sort of, the approach that you have towards patient in a private setup is much different. So I learned a lot from here after I came back, and now you approach your patient. You're more pleasing. You have to talk to them. You have to understand things like that. But even a lot of places, even private setup, see, after the problems, after a while, after a few years of practice, everything becomes a bit mechanical.
True.
So a human touch പോവും.
Yeah, absolutely.
Patient side interact ചെയ്യുന്നത്. So that was something I realized, and from a lot of my friends, like female friends who have had bad experience with gynecs and things like that. So they would come and tell me. So then, I mean, initially I was like, you're going to a doctor, what do you expect?
They've probably had a bad day. Have you thought about
that is but then, see, you're dealing with women. Gynecs, mainly അതാണല്ലോ. So again, it could be their state of mind could be different from day to day. Could be their work. It could be problems at home. Or it could be hormones. That is a known fact. Hormones do affect their
behavior. Absolutely, yeah.
And it's normal. You have to accept that. That's the truth. Now, for example, when you're doing a scan for a patient, so a lot of places they talk about how, the sensitivity ഇല്ലാതെ ചെയ്യുന്നത്, especially if it's a vaginal scan.
Yes.
So probe they just shove it there. So those are things like I especially when I do it, I talk to them, and then നമ്മളൊരു consent and സംസാരിച്ച് പതുക്കെ a lot of patients are comfortable because of that. Because either I made these changes because I've heard experience from other people.
Yeah.
So only thing is that you have to be in a position where you should listen. ആ ചേഞ്ചസ് വരുത്തണം എന്നുള്ളൊരു ഇത് മനസ്സിലാക്കണം. ലോട്ട് ഓഫ് ഡോക്ടേഴ്സ് ലൈക്ക് അത് എന്തിനാന്നുള്ളൊരു സോർട്ട് ഓഫ് ഒരു തോട്ട് പ്രോസസ് ഉണ്ട്. For doctors, basically, sometimes it's very difficult to change from a certain.
I suppose that comes with age also.
Yeah.
And I face that in my center as well. If I'm bringing about any new system or any change, one of the most common complaints I get, because my dad's no longer there, one of the most common, അച്ഛനുണ്ടായിരുന്നപ്പോൾ ഞങ്ങൾ ഇങ്ങനെയൊക്കെ ചെയ്തിരുന്നത്. ലൈക്ക് ഓക്കെ ശരിയാണ്, പക്ഷെ കാലം മാറി. ഇതിപ്പോൾ this is not 2015, this is 2024. We need some changes. ബാക്കി എല്ലാവരും ഇങ്ങനെ ചെയ്യണം. അപ്പം ഇങ്ങനെ കൺവിൻസിങ് ദം പറയുന്നത്, these are all people who've been around for a while, and ഇവരെല്ലാവരും ആവറേജ് is like 50s, 50s, between 50s and 60s, they're significantly older to me as well. So I cannot just boss them. Convincing them of getting that change. And doctors, one of the two things I've seen with doctors is, one, the moment you start talking to them about numbers, it's like എന്താണ്ടോ ഡ്രാക്കുല എടുത്ത് കുരിശടിച്ചോ. It's like numbers പറഞ്ഞാൽ എനിക്കൊന്നും അറിയില്ല, എനിക്കൊന്നും മനസ്സിലാവില്ല. Like, relax, ഇതൊന്നുമല്ല.
That is a problem with doctors in general. I mean, finances or numbers are like topics which are.
That's just a mental block. Like
that is there. That's true.
Especially ഈ കാലത്ത് lot of doctors are practicing. They are setting up their own centers.
Yeah.
So this is one thing which I experienced. I'm currently doing a course with ISB.
Okay.
So 70% of my batch is doctors. Okay. So when I talk to them, and I'm from a core business background, so finance for me is easy. So whenever something finance related is coming, these guys come to me with like please explain. They have this strong mental block against finance and math.
Yeah.
And satyam parnaya, I am surprised. I mean, like, you guys are doctors. You have any idea how difficult it is, like what you studied past and what you are doing? Like most of us, നിങ്ങളുടെ പണി ചെയ്യാണ്ടിരിക്കാൻ വേണ്ടി ഞങ്ങൾ ആർട്സ് എടുത്തിട്ട് ഫൈനാൻസിലേക്ക് പോയത്. And you guys are like afraid of finance. And the thing is, I feel like the MBBS, right, as a course as such, should include in some element, like maybe rudimentary math, rudimentary finance, in a particular level, at least at MBBS level.
MBBS level, I think not just finance, a lot of things which is lacking. See, we are taught about diseases and everything. We never taught how to handle a
behavioral things.
I mean, I remember during my house friends, my internship, So in our medicine posting, we had ward posting.
Right.
So one of the night, a patient passed away, and the nurse called me and told me, and I have to go and declare the death. It's my first time. I've never done that before. Nobody has ever told me how to do it.
Okay.
You just go there.
Oh, he's dead.
Is like checking the pulse, asking for an ECG, checking the pupils. അവസാനം എങ്ങാനും നമ്മൾ So you're like, yeah, back of your mind, you're thinking, what else to do? What else to do? You're doing all this. And then you've confirmed patient has a passed away. I'm sorry because I'm laughing.
No, it's true.
Quite an experience. So then I have to declare to the patient, to the bystander, like, I don't know how to do this. ഇത് നമ്മൾ എങ്ങനെ പറയാ ഈ മലയാളം സിനിമ പറയണ പോലെ ഇങ്ങനെ ആള് പോയി
you have to be sensitive about it as well,
I mean, അവരെല്ലാരും they were expecting that death, but still നമ്മൾ പറയുമ്പോൾ ആ ഒരു സെൻസിറ്റീവ് ആയിട്ട് തന്നെ പറയണല്ലോ. These are things that is never taught. You're just pushed into the it's like you survive, you figure out.
But so these sort of things, I mean, it has to be taught. And especially coming back to what you were saying, like even a lot of my friends, female friends, they dread going to the OB gate. Okay, and this is one thing I tell my doctors as well. Like, be a little sensitive.
Yeah.
Be a little sensitive, be a little compassionate. They dread going to the OB guide because ഈ പറഞ്ഞ മാതിരി scan ഒക്കെ ചെയ്യുമ്പോൾ they are very brutal.
Yeah.
They are very ruthless. There's like they dread going to the OB guide.
And it'll be a busy OP. And the doctor doesn't have time to listen.
Yeah, exactly. അപ്പോൾ ഡോക്ടറും കുറ്റം പറഞ്ഞ കാര്യമില്ല. കാരണം പുറത്ത് വേറെ 30 പേഷ്യന്റ് വെയിറ്റ് ഉണ്ട്. And it's already 1 o'clock. ഡോക്ടർക്ക് ഇത് കഴിഞ്ഞ് ലഞ്ച് ചെയ്തിട്ട് even the doctor has a life as well, right?
Exactly.
അപ്പോൾ ഡോക്ടർ just trying to finish it off as mechanical as possible. But I tell them, like, so listen, understand that's a human. Try and, be a little more tactful, be a little more gentle. But that's it's a fairly common problem, right? But I mean,
the problem is especially when it's a busy OP.
Yeah.
That's the main problem. So in our place, what we do is we've got assistant doctors as well. So it's sort of split, like history taking is done by.
So that's what, yeah.
ഒന്ന് പേഷ്യന്റ് റൗണ്ട് അടിച്ച് വന്ന് വേഗം തീർത്ത് പോവാം. ഈ പറഞ്ഞ പോലെ promise nobody wants to wait. അതും കംപ്ലൈന്റ് ആണ്. പക്ഷെ at the same time when they come inside the OP, they want to sit and talk.
Yeah, true. But to be honest, Satyam Barnaya, like, and I've read various cases in like from various hospitals around the world. Yeah. OP waiting time, it is a universal issue.
Yeah.
It is a universal issue. The hospital boy kanyalam. It's a universal issue. And I honestly right now I'm actually trying to figure out if there's some way like there are a lot of management principles and all you can apply for this. But the problem is, medicine, each patient is very unique. History taking time.
Definitely, you have to go into depth.
Yeah.
Because a lot of things are found out during the history taking.
Especially when you have two kinds of patients. For example, on one OP is a pediatrician, the other OP is an OB-GYN.
Yeah.
Random history taking time is significantly different. Pediatrician shut up and the patient kind of the parent is consulting. Pediatrician is not consulting the baby, he's consulting the parent. And the parent is the one deciding the simple. symptom. Okay, this is the question.
Current set of parents are all Google educated.
Already Google educated.
All symptom name, diagnosed.
Exactly. OB-GYN is you have to start at the very beginning. Menstruation kittiya prayam thottilla endokka history.
Funny thing is, when it comes to kids, they are very aware of things.
Yeah.
Women, like grown women, middle-aged women, menstrual health, some of them are like, they'll be asking their husband, when was my last menses?
Yeah, that's a very common thing. To be honest, I won't lie. I used to track my wife's periods till a little while back, till we had our baby. I think when I stopped, but yeah. I had a calendar marked out.
On your phone?
On my phone, I had a calendar marked out. So I knew like whether she's on time or like, moon was
you have to know, the husband has to know.
Yeah, so it was, I used to do that. You're absolutely correct. But yeah, women.
So women, when it's about their own health, they are worried about their kids, run the house. So some of them will be like women with heavy bleeding.
Mm-hmm.
So how is your bleeding? It's like, it's very normal, average. We evaluate them, our hemoglobin blood level, it'll be, so normal is 12. They'll be having like 6 or 7.
Right.
And you're like, how have you been surviving? Because she's been having heavy bleeding, but then she's been bleeding heavily for a long while. Then it becomes a normal, and her mind is somewhere else.
Right.
Husband, jolly. and she's probably working as well, looking after the children.
I face that with my wife as well. She is the moment she has to get on any sort of medication, or even my mother as well. എന്തെങ്കിലും മരുന്ന് ഇതാണെങ്കിൽ ഉന്തി തള്ളി ഹോസ്പിറ്റലിൽ കൊണ്ടുപോകാനായിട്ട് ഐ ഹാവ് ടു ആക്ച്വലി മേക്ക് കോൾസ് ടു അതർ ഡോക്ടേഴ്സ് എന്നിട്ട് അവരെ കൊണ്ടേ പറയിപ്പിക്കണം.
Doctors are the worst patients. That is also there. Your mom being a gynecologist.
അമ്മയുടെ അടുത്ത് അമ്മയ്ക്ക് എന്തെങ്കിലും അസുഖം പറയുമ്പോൾ അമ്മയ്ക്ക് പിന്നെ എല്ലാം അറിയാലോ, അപ്പോൾ കുഴപ്പമില്ല. അപ്പോൾ ഏതെങ്കിലും ഡോക്ടർ കൺസൾട്ട് ചെയ്ത് അവർക്കൊന്നും അറിയാം, അത് തെറ്റാ. അമ്മയ്ക്ക് പിന്നെ എല്ലാം അറിയാലോ, കുഴപ്പമില്ല.
Recently my mom had like a skin reaction. My wife, she's a ENT surgeon. Again, we were telling her go see her doctor. Like my dad and my mom were like, illa adu onnu illa adana and they applied some medicine. I mean, fortunately ശരിയായി, കുഴപ്പമൊന്നും ഉണ്ടായില്ല. The same thing.
Yeah, but the same thing with my wife. She's got a mental block against medication. For മരുന്ന് കഴിക്കില്ല. അത് അവസാനം നിവൃത്തി കെട്ടാതാകുമ്പോഴത്തേക്കും ഇറ്റ്സ് ലൈക്ക് ഓ മൈ ഗോഡ് വിൽ യു ജസ്റ്റ് ഗോ എന്ന് പറയുമ്പോഴത്തേക്കും ഓക്കെ ഉന്തി തലയോടെ എത്തും. ആൻഡ് ദെൻ ഷീസ് നോട്ട് റെഗുലർ വിത്ത് ഇറ്റ് ആസ് വെൽ. അത് പിന്നെ എൻ്റെ തലവേദന. I have to monitor that. But then again, women generally are a lot more neglectful of their health, and I think there's a cultural aspect as well. And the fact that they have to, like you said, they have to multitask. ഒന്നും സമയം കിട്ടാറില്ല അവനൊരു കാര്യം നോക്കാനായിട്ട്. വീട്ട് ജോലി കൊച്ച് എല്ലാം കഴിഞ്ഞ് പോകുമ്പോൾ
most of the women are working as well. It's a difficult task.
It's true, but I think it is changing now a little. I mean, kids are, women are becoming a little more mindful, and especially when it comes to like most gyms, എല്ലായിടത്തൊക്കെ നോക്കിക്കഴിഞ്ഞ് കഴിഞ്ഞാൽ ഡയറ്റ്സ് ആൻഡ് ജിംസ് ഒക്കെ നോക്കിക്കഴിഞ്ഞ് കഴിഞ്ഞാൽ women are getting into that space a lot more.
ഈ OP കാര്യം പറഞ്ഞപ്പോൾ, so I think you said correct managerial കാര്യങ്ങളുണ്ട്.
I'm trying to do that.
See, one thing I've seen, like, so I'd gone to in UK, I'd gone to this IVF clinic. I did an observership for like a few days. So after OP they only see like handful of patients a day,
right?
Maybe 2 or 3 patients, that's
right.
So അങ്ങനെ 2-3 പേഷ്യൻറ്റ് കാണുമ്പോൾ you can like really plan it out. You can spend an entire hour. So പക്ഷെ അവിടെ same time that 1 hour of OP the patient has to be spend like probably 100-200 pounds.
വ്യത്യാസമുണ്ട്.
നമ്മളിവിടെ 200-400 രൂപയാണ് ഇത് ചെയ്യുന്നത്. So that is one difference. It's not easy to.
You cannot exactly replicate that. ഇങ്ങനത്തെ കാര്യം പറയുമ്പോൾ like I hear a lot of examples ആൾക്കാർ പറയുന്നത് like സ്വീഡനിൽ ഇങ്ങനെയായിരുന്നു, അവിടെ നോർവേയിൽ ഇങ്ങനെയാ, അവിടെയൊക്കെ എന്തൊരു പെട്ടെന്ന് നടക്കണേ. ലൈക്ക് സ്വീഡനിൽ അവിടെ 10 പേരെ താമസിക്കുന്നുള്ളൂ.
ഇങ്ങനെ പറയുന്നത് പേഷ്യൻസ് ഇങ്ങനെ കമ്പയർ ചെയ്യുന്നത് US and UK. അവർക്ക് ഡോക്ടറെ പോയി കാണണമെങ്കിൽ they have to appointment with the GP first. അത് തന്നെ probably takes a few weeks. GP-നെ പോയി കാണണം. Patient might be having a gynec problem or a ophthalm കണ്ണോ സ്പെസിഫിക് കാര്യങ്ങളായിരിക്കും. GP is not going to refer them directly. GP കുറെ ട്രീറ്റ് ചെയ്യാൻ നോക്കും. So അവർക്കും there's a register, like there's a they have to submit the number of patients that has been referred to a specialist.
Right.
As the number increases, it's bad for the GP. So they try not to refer. So maximum ചെയ്യാൻ നോക്കി അത് കഴിഞ്ഞ അവസാനം you go to the specialist, you might get an appointment after a few months, and then you might actually require a surgery. That appointment would be after 1 or 2 years. This is a situation in UK. ഇതൊന്നും ആരും പറയില്ല.
That's true. But I mean, see, അങ്ങനെ നോക്കുകയാണെങ്കിൽ what I've seen from my experience, our healthcare system in India is still, as far as cities are concerned, we're still doing a good job. We're still, I honestly feel we're doing a good job, but we still need to reach a lot more people, especially in the rural areas.
Definitely.
In rural areas.
I think, see, Kerala's
leaps and bounds ahead of talking.
Kerala, I think there's no rural area as such. എല്ലായിടത്തും പറഞ്ഞ പോലെ there's enough technology and hospitals and everything, easy reach ഉള്ളതാ. But I think outside our state, it's
even these my batchmates in ISB. So there are people from like all from Kashmir, UP, Rajasthan, Bihar, Delhi, all these places, and then a lot of them from Andhra, everything. Most of them, satyam parnaya, they are in awe of Kerala.
Okay.
Samsarikimbo, they are like, how you Kerala people do things so differently? How is Kerala so ahead of a lot of these things? Especially when it comes to healthcare, because that's the area which you're studying. I think we do a very good job, and even നമ്മുടെ government, regardless of whichever political party is in power, there are നമ്മൾ പാരമ്പര്യമായിട്ട് സെറ്റ് ചെയ്തേക്കണ കുറെ ഹെൽത്ത് കെയർ സ്ട്രക്ചേഴ്സ് ഉണ്ട് ഇവിടെ കേരളത്തിൽ, and they are doing a good job.
Ernakulam GH. I think it's one of the best general hospitals.
One of the best general hospitals there is. Angawadi, they do a good job.
See, I think ആൾക്കാർക്ക് ഇത്തിരി കൂടി ഒരു ലിറ്ററസിയുടെ അല്ല, ഒരു ഇത്തിരി കൂടി ഒരു
Literacy definitely ഉണ്ട്. Common sense is in a way tied to that literacy.
Yeah.
If you look historically, bit controversial, പക്ഷേ places where people are blindly religious,
Yeah.
right? Those places education comparatively കുറവാണ്. The more educated you are, you tend to reason better.
അതെ.
You tend to why എന്താണ് ചോദ്യം എന്ന് പറഞ്ഞാൽ it comes with that comes with education. കേരളത്തിൽ എഡ്യൂക്കേഷൻ ആയതുകൊണ്ട് ഇവിടെ ചില സമയത്ത് വായിച്ചു നോക്കൽ കുറച്ച് കൂടുതലാണ്, ഇവിടെ കുറച്ച് കൂടുതൽ ചോദ്യം. ബട്ട് we still understand what കേരളത്തിലെ ആൾക്കാർ കുറച്ചുകൂടി പ്രാഗ്മാറ്റിക്കാണ് കാര്യത്തിന് അണ്ടർസ്റ്റാൻഡിങ്ങിൽ. എസ്പെഷ്യലി കോവിഡ് വന്ന സമയത്തൊക്കെ വി വുഡ് ബാക്കി ഒരു ടെസ്റ്റ് ചെയ്യൂലായിരുന്നു. കേരളത്തിൽ ബാക്കിയല്ലേ എവരിവർ പതിവ് കംപ്ലൈന്റ് വാസ് ലൈക്ക് അതേപോലെ കേരള കോവിഡ് സോ മച്ച്. ഇറ്റ്സ് ബിക്കോസ് വി ആർ വോളണ്ടിയർലി ഗോയിങ് ആൻഡ് ടെസ്റ്റിംഗ്. എനിക്ക് ചുമ വന്നു കഴിഞ്ഞാൽ എനിക്ക് ഉടനെ തന്നെ പേടി, എനിക്ക് കോവിഡ് ഉണ്ടോ, ബിക്കോസ് ഐ ഹാവ് പീപ്പിൾ നെക്സ്റ്റ് ടു മീ. So I am trying to take a proactive measure to go see if I am sick. So our testing numbers are high because you were volunteering.
There was actual testing going on.
Yeah, there was actual testing going on.
I mean, there were on the newspaper, there were a lot of fake reports and everything.
Yeah, I mean, that is a whole...
Kerala is a whole different situation.
It is a different. So these guys always tell me, how are you people so ahead? How are you people doing so differently? That's because I feel it's one, because these structures which are put in place. One, secondly, it's not an endorsement of any party or anything. But then again, I feel culturally we are a little more socialistic in our approach to healthcare. We do have big hospital, private enterprises, but government is also doing a good job. Okay, government is doing a good job. And ഇപ്പം നമ്മുടെ ഹോസ്പിറ്റലിൽ ഇപ്പോൾ ഒരാൾ വന്നു കഴിഞ്ഞാൽ, okay, and if the patient is unable to somehow pay the bill or is facing a difficulty, we will be more inclined to എന്തെങ്കിലും രീതിയിൽ നമുക്ക് അഡ്ജസ്റ്റ് ചെയ്ത ട്രീറ്റ്മെൻറ്റ് കൊടുക്കാം, ഇൻസ്റ്റെഡ് ഓഫ് നിങ്ങൾ വേറെ സ്ഥലത്ത് പോയി ട്രീറ്റ്മെൻറ്റ് എടുക്കുക. We put that treatment aspect first, and this I've seen pala hospital. I've actually seen that. I mean, be it for even places like large hospitals like Aster or my center or your center. I've heard that chikitsa kittu.
I think a lot of hospitals, one of the medical college, medical. So whenever such a patient comes, affordability is an issue. They have a foundation and stuff.
Yeah, exactly.
They ask them to apply for it, and there's always they find a way.
They find a way. So there is a certain socialistic approach when it comes to healthcare. Like we, exactly egalitarian alla, പക്ഷെ ഒരു എല്ലാവർക്കും എന്തെങ്കിലും കിട്ടണം ആ ഒരു അപ്രോച്ച് ഉണ്ട്, which I think is very unique.
Cost wise also relatively compared
to other states,
Mumbai or
absolutely.
Mumbai, Delhi, അങ്ങനെയൊക്കെ നോക്കുമ്പോൾ you can't compare our city, but then എന്നാലും cost is significantly different.
See, but the thing is, our competence is equally good.
Yeah.
The cost, healthcare cost is something
same level of treatment.
Yeah, so cost and competence is something which is, it should be equitable. No, healthcare for this competency itra charge ആവും. ഇപ്പോൾ ഡൽഹിയിൽ മുംബൈയിലൊക്കെ അതിന് കൂടുതലാണ്. മെയിൻലി അവിടെ എന്ന് പറഞ്ഞു കഴിഞ്ഞാൽ ബിക്കോസ് കോസ്റ്റ് ഓഫ് ലിവിംഗ് ഇസ് ഹയർ, മെറ്റീരിയൽ ചാർജസ് ഹയർ ആണ്. അവിടെ ഒരു ഹോസ്പിറ്റൽ പണിയാൻ തന്നെ ഇത്ര ചാർജ് ഉണ്ടാവും, എല്ലാം ഉണ്ടാവും. സോ ദേ ആർ ലുക്കിംഗ് ടു റിക്കവർ ദാറ്റ്. ആ ഡോക്ടറിന്റെ സാലറി ഇത്ര കൊടുക്കേണ്ടി വരുമല്ലോ. സോ ഹിയർ ഇറ്റ് ഇസ് ചീപ്പർ കമ്പാരിറ്റീവ്ലി. പക്ഷെ എന്നാലും യു ഗെറ്റ് എ ഗുഡ് എമൗണ്ട് ഓഫ് കോമ്പറ്റൻസ് കേരളത്തിൽ. സംതിങ് വിച്ച് ഐ ഹവ് സീൻ. ആൻഡ് മോസ്റ്റ് ഓഫ് ദി അതർ സ്റ്റേറ്റ്സ് ആർ ആക്ച്വലി എ ലോട്ട് ഓഫ് ദം ആർ ഇൻ ഓ ഓഫ് us what we are doing, and that I think we as Malayali should be proud of that. Absolutely. കാര്യത്തില്
പറഞ്ഞ പോലെ lot of these patients UK എന്നൊക്കെ വരുന്ന UK, Canada ഒക്കെ മലയാളികൾ അവർ പറഞ്ഞ പോലെ when they have an actual disease and when they are trying to get the treatment done there, and ഈ പറഞ്ഞ പോലെ നമുക്ക് കയറി ചെന്ന് ഒരു പെട്ടെന്ന് സർജറി ഒന്നും ചെയ്ത് വരാൻ പറ്റില്ല. That's when they realize നമ്മുടെ നാട്ടിൽ അവര്
it's like my brother-in-law is in London, so I constantly make fun of him. Like every time he comes around, it's like ഇത്തോണ്ട് ഡെന്റിസ്റ്റിന്റെ അടുത്ത് പോണില്ലേ, അവിടെ ഡെന്റിസ്റ്റിന്റെ അടുത്ത് ഒരാൾ പോയി കഴിഞ്ഞാൽ എനിക്ക്
പറഞ്ഞ അപ്പോയിന്റ്മെന്റ് കിട്ടണം. I think literally you'll have to donate your kidney.
ഒരു പല്ല് ശരിയാക്കാനായിട്ട് പുള്ളി ഇവിടെ വന്നു കഴിഞ്ഞാൽ എവിടെ കമ്പനി ഡെന്റിസ്റ്റ് എടുത്തോ എല്ലാം മൊത്തം ശരിയാക്കാൻ എല്ലാം ചെക്കപ്പ് എല്ലാം ശരിയാക്കും. യൂഷ്വൽ നോർമൽ NRI thing, especially in the one staying in UK and US. ഗൾഫിൽ പിന്നെങ്കിലും കുഴപ്പമില്ല,
ഇത്തിരി കൂടി
approachable ആണ്.
It's insurance and things I think
right
is manageable.
Lot of patients in hospitals they come and ask for discounts, are unable to meet the bill because of they don't have insurance. And I find it strange, കാരണം ഇവിടെ നമ്മൾ ഇത്ര എഡ്യൂക്കേറ്റഡ് ആയിട്ടുള്ള ആൾക്കാരായിട്ടും നമ്മൾ ഇൻഷുറൻസ് കവർ, ലൈക്ക് ഫോർ എക്സാമ്പിൾ ഇൻ ദ ടോട്ടൽ ലിസ്റ്റ് ഓഫ് റാങ്കിങ് I think the most poorly insurance covered state, I think, is J&K, Jammu and Kashmir.
Oh.
Okay. And the highest is, I think, Rajasthan or something. Yeah, is
properly insured.
Yeah, probably people who are health insurance cover.
Yeah.
Kerala ranks somewhere in the middle.
Okay.
പക്ഷേ എഡ്യൂക്കേഷൻ വൈസ് എല്ലാം വെച്ച് നോക്കുമ്പോൾ യു വുഡ് എക്സ്പെക്ട് കേരള ടു റാങ്ക് എ ലിറ്റിൽ ഹയർ. എന്നിട്ട് എൻ്റെ അടുത്ത് ഇപ്പോൾ 2-3 പേര് വന്നിട്ടുണ്ട്. കമൻ ആസ്മി ലൈക്ക് സാർ ഇൻഷുറൻസ് എസ്പെഷ്യലി ഈ ഓട്ടോ ഡ്രൈവേഴ്സ് അല്ലെങ്കിൽ ബസ് ഡ്രൈവേഴ്സ് അവർ അസോസിയേഷനിലെ ആൾക്കാർ ചിലപ്പോൾ വിളിക്കും സാർ ഇങ്ങനെ ഒരു ട്രീറ്റ്മെൻറ്റ് ഉണ്ട്, നമുക്ക് ഇൻഷുറൻസ് ഇല്ല. ഞാൻ അവസാനം ചോദിക്കാറുണ്ട്, അപ്പം സി നിങ്ങളൊരു അസോസിയേഷൻ അല്ലേ, സി ഞാൻ ഒരാളുടെ അടുത്ത് ചോദിച്ചത് നിങ്ങൾ വണ്ടി ഓടിക്കുന്നതാണ്, ഇവരാണ് ഓട്ടോ ഡ്രൈവർ, നിങ്ങളുടെ വണ്ടിക്ക് ഇൻഷുറൻസ് ഉണ്ടോ? ഇൻഷുറൻസ് ഉണ്ട്, ഇല്ലാണ്ട് ഗവൺമെൻറ് നിങ്ങൾ വണ്ടി ഇറക്കാൻ സമ്മതിക്കില്ല. ഓക്കെ, നിങ്ങൾ വണ്ടിക്ക് ഡാമേജ് ആയി കഴിഞ്ഞാൽ യു നീഡ് ഇൻഷുറൻസ്. അതുപോലെ നിങ്ങൾ വണ്ടി യു ആർ ഇൻ ഓക്യുപേഷണൽ ഹാസഡസ് പ്രൊഫഷണൽ ആണ്, നിങ്ങൾക്ക് ആക്സിഡൻറ്റ് എപ്പോഴെങ്കിലും ഉണ്ടാവും. എന്തുകൊണ്ട് ഇൻഷുറൻസ് ഇല്ല? അതൊക്കെ സാറേ കഴിഞ്ഞ കൊല്ലം വരെ ഉണ്ടായിരുന്നു, ഞാൻ പ്രീമിയം അടച്ചിട്ടുണ്ടെങ്കിൽ ഈ കൊല്ലം അടച്ചില്ല. ആ ഒരു സൈക്കോളജി ദാറ്റ് ഇൻഷുറൻസ് ഇസ് സംതിങ് വിച്ച്
അതിന്റെ ഇമ്പോർട്ടൻസ് ആൾക്കാർ,
അതൊരു എക്സ്പെൻസ് അല്ല, അത് ആക്ച്വലി വേണ്ട സമയത്ത് ലൈക്ക് യു നോ ഇറ്റ്സ് ബെറ്റർ ടു ഹാവ് ആൻഡ് നോട്ട് നീഡ് ഇറ്റ്.
എക്സാക്ട്ലി, റിഗ്രറ്റ് ചെയ്യരുത്.
Yeah, regret it and to need and not have it.
I mean, so like my parents have got it, I've got it. Funnily, I'm the one who was only utilized it.
Yeah.
I had a knee surgery long back. I was the only one who was actually utilized it. So my dad is like, പറഞ്ഞാലും പ്രായപ്പോ കുറെ കാശ് അടച്ചു, ഇപ്പൊ പ്രീമിയം പിന്നെയും കൂടി. ഇത് is there any point in doing this? But then
പറയാൻ പറ്റില്ല.
you have to continue it. If you break it,
but it's required as well, you know, and I see this with general populace, the people who actually seek out treatment. ഇൻഷുറൻസ് ഇല്ല, കാശ് വേണം, കാശില്ല, കാശിന് വേണ്ടി ഫണ്ടിങ് വേണം, അത് വേണം, ഇത് വേണം, ക്രൗഡ് സോഴ്സിങ്. ഓക്കെ, മണി യു മൈറ്റ് ക്രൗച്ച് ഇറ്റ് ആൻഡ് ഗെറ്റ്, പക്ഷേ ഇൻഷുറൻസ് ഉണ്ടായിരുന്നെങ്കിൽ ഗുഡ് എമൗണ്ട് ഓഫ് ഇറ്റ് വുഡ് ഹാവ് ബീൻ കവർഡ്.
I think that awareness,
yeah, it has to.
ചിലർക്ക് പറഞ്ഞു എനിക്കൊന്നും വരില്ല, എനിക്ക് പ്രശ്നമൊന്നും ഉണ്ടാവില്ല എന്നുള്ളൊരു ഒരു മിസ്കൺസെപ്ഷൻ ഇസ് ഓൾസോ ദേ നമ്മുടെ നാട്ടില്.
അതന്നെയാണ്.
I think from a young age your awareness has to be there.
People need to know that they should realize that it's not an expense.
Like younger you are, your premium is low. So അത്രയും ബെറ്റർ ആണ്. വയസ്സാങ്കാലത്ത് എടുക്കാൻ പോയാൽ you will have to undergo the entire evaluation.
Check-up എടുക്കേണ്ടി വരും.
Anything problem ഉണ്ടായി they won't give you as well.
True, absolutely.
So younger the better.
Yeah. Any like misconceptions or like big like anything that grinds your gears, like what pisses you off when you hear like general public in the health ne pattilla misconceptions or anything?
ഈ പറഞ്ഞ പോലെ people have a thing against doctors.
Okay.
പണ്ട് I mean doctors were considered very noble and you know all that. ഇപ്പൊ പിന്നെ എന്ത് ചെയ്താലും ഇപ്പൊ again a lot of these newspaper articles about medicines and this and that, commissions and you know, അപ്പൊ അതൊക്കെ വന്നിട്ട് ഇപ്പൊ ഓൾറെഡി ഇസ് ലൈക്ക് യു നോ അയാള് ആ ഡോക്ടർ ആ മെഡിസിൻ തരാൻ അയാൾക്ക് കമ്മീഷൻ കിട്ടാനായിരിക്കും. He's doing this for you know his own personal interest and things like this has to change.
True.
And then if you പറഞ്ഞ പോലെ some mishap happen, not mishap, like you know there are certain known complications to certain diseases or surgeries, or for that matter a delivery, baby delivery, there are complications associated with it. It's not like you know all 100% എല്ലാതും safe ആയിരിക്കണം. There can be problems. The moment something like that happens, the doctor is accused of negligence. And maybe നമ്മുടെ ആൾക്കാർ വന്ന് ഹോസ്പിറ്റലിൽ തല്ലി പൊട്ടിക്കുക, ഡോക്ടറിനെ പോയി തല്ല. These are all things that has to അതും ഈ പറഞ്ഞ ഇത്ര എഡ്യൂക്കേറ്റഡ് ആയിട്ടുള്ള ഒരു സ്റ്റേറ്റ്. This is not confined to our state.
Even I think it's comparatively reduced now. ഇപ്പൊ ഓഫ് ലേറ്റ്ലി കുറവാ.
whole idea about ആ ഡോക്ടർ പൈസ ഉണ്ടാക്കാൻ വേണ്ടി നടക്കണതാന്നുള്ളൊരു sort of thing has to, I mean if you look at all these online, some Reddit or some of these blog, there'll be people putting this comment, then there'll be somebody else who's saying that you can't expect doctors to work for
free charity. Work for charity.
Who's going to pay for his food? Who's going to pay for the electricity bill? ആൾക്ക് എല്ലാവർക്കും ഒരു ആഗ്രഹമില്ല ജീവിതം ചെയ്യാൻ വേണ്ടി. So I mean it doesn't make sense.
True. I mean,
and like they should also understand. The other day I was talking about like operating in a hospital elsewhere, then patient had a bit of a cardiac issue. Patient is fine, കുഴപ്പമൊന്നുമില്ല, എന്നാലും there's a lot of stress on the surgeon and the anesthetist. We are getting paid for it, but still there's a lot of thing that goes through your mind. And you know every day I'm calling up that hospital, checking on the patient, what's happening. ഇതെല്ലാം ഉണ്ടപ്പോ ഈ stress is also a big thing. അത് ആൾക്കാർ മനസ്സിലാക്കുന്നില്ല. If the doctor is taking a higher fee, these are all things that matter. The years spent in your college, the number of training that you undergo after that,
right,
and the sort of stress that you have to handle.
Basically, the patient, if they are doing a surgery with ex-doctor, you're paying for that ex-doctor's competence.
Yeah.
പക്ഷേ ഒരു സർജറി ചെയ്യുമ്പോൾ surgery is a complicated affair.
Yeah. There can be a
There
lot
are
of
million things that can go wrong in
variable,
surgery.
yeah.
Million things that can go wrong in surgery. And the fact that surgery successful ആയിട്ട് വരുന്നത്, it's partly due to the competence and definitely God's hand in it.
Absolutely. There's no doubt about it.
That's what I mean. Any doctor I know, what they solved would have obviously.
Even when everything is going right,
Right.
there's still a percentage of, there's still a chance that things can go wrong.
Right.
As much as possible, we try to control all the variables.
Okay.
But certain things is out of our hand.
Okay. Yeah. Well, one thing which like we're talking about, like misconceptions, is like, especially when it comes to women's health. So I'm a big proponent of like going to the gym, like be active, and maybe even strength training, like for women, like because നമ്മുടെ നാട്ടിൽ പാരമ്പര്യമായിട്ട് തന്നെ വയസ്സാവും തോറും മുട്ടുവേന, നാലുവേന, നടുവേന എല്ലാം വരുന്നതാണ്. ഓക്കെ, ദാറ്റ്സ് വൺ മെയിൻ തിങ് ഈസ് വിമൻ സഫർ ബോൺ ലോസ് ആസ് ദേ ഗെറ്റ് ഓൾഡർ. അത് പ്രത്യേകിച്ച് ഇപ്പോഴത്തെ ഒരു ലൈഫ് സ്റ്റൈൽ വെച്ച് നോക്കുമ്പോൾ ദേ സഫർ ബോൺ ലോസ്. You need to strengthen your muscles to support that bone loss. To strengthen that muscle, you need to go to the gym. You need to eat and you need to work out. So one of the common things I've heard is, I've even heard it from my wife, and I tell her like, just come to the gym. So she used to work out with me before, but right now we just had our second baby, so she's taking time off. So I tell her to come back, and I was telling her like, she's like, I need to shed this much weight, I need to lose this much weight. So I told her like, yeah, you should come and like, do a bit of PT or maybe like weight train or something. She's like, but I don't want to become muscular. I don't want to become muscular. Like,
Exactly.
You won't become muscular. അല്ലെ, ഒന്നാമത് മസ്കുലർ ആവാനായിട്ട് കുറച്ച് ബുദ്ധിമുട്ടുള്ള സംഭവമാണ്.
I'm not working out for a long while, but when I was working out again, ഈ പറഞ്ഞ പോലെ how much ever you work,
അങ്ങനെ വലിയ മസിലൊന്നും വെക്കൊന്നുമില്ല.
you become all muscular like all these models. Then whatever you do,
that takes a long time and a huge, very a strict regimen to achieve that.
Your diet, everything.
Yeah, everything. അല്ലാണ്ട് പോയിട്ട് ചുമ്മാ രണ്ടൊരു ഡംബൽ എടുത്ത് വെച്ച് കഴിഞ്ഞാൽ ഉടനെ ആൺ ഷോർട്സിനെക്കറിന്റെ ബോഡി വരാൻ പോകണമെന്നില്ല.
Friend of mine, ഈ പറഞ്ഞ പോലെ, she was saying how, husband says you are becoming muscular.
Okay.
When she was working out.
Oh.
And then she stopped working out.
I mean, I feel women, again, comes back to the whole thing of them being neglectful of their health. I think if the woman is healthy, everybody connected to that woman is healthy. Right?
And sometimes you get inspired.
Yeah. You get inspired.
Like your child will see you working out, and
Yeah.
I think, okay, that is something you should be doing.
Children of unfit parents wind up usually being unfit themselves.
Yeah.
The exact opposite as well. Children of fit parents wind up being fit. But it's something which അവർ കണ്ടുപഠിക്കുന്നതാ.
ആ ഒരു normalcy എന്താന്നുള്ളൊരു
that has to be bought in, if you ask me. I mean,
നേരത്തെ bone loss പോലെ മാത്രമല്ല, ഇപ്പൊ same thing for women and men as well. As you grow older, you're losing muscle as well.
Yeah.
So the older you are, it becomes more difficult to become muscular.
Yeah, it's difficult, exactly. Yeah. I mean, the reason I say specifically women naturally have a less muscle density than men. പ്രായം കൂടുന്തോറും ഉള്ളതും കൂടി കുറയും.
So ഞാൻ recently operated with a patient, so she's got a very literally, I mean, there was no muscle on her abdomen.
Okay.
Like there's no tone.
Okay.
So during our surgery, we inflate the abdomen with gas.
Yes.
So the inflated is like balloon പോലെ ഇങ്ങനെ വീർത്തിരിക്കുക. So surgery was done, was a uterus removal surgery, not very enlarged. I mean, it was slightly big. So then I'm talking to the husband. So he was like, sir, ഇപ്പോൾ യൂട്രസ് എടുത്ത് മാറ്റിയായിരുന്നു ഇനി വയറൊക്കെ ഒതുങ്ങില്ലേ? അപ്പൊ പറഞ്ഞു, യൂട്രസ് ഇതുമായിട്ടൊരു ബന്ധം ഉണ്ടായിരുന്നില്ല. വയറിന് ഒരു മസിൽ ഒന്നുമില്ല. ബിക്കോസ് സോ അത് പറഞ്ഞപ്പോൾ he was like, ഭാര്യയ്ക്ക് ഭയങ്കര മടിയാണ്, അനങ്ങാനും എക്സസൈസ് ചെയ്യാനും ഒന്നും പറ്റില്ല. So literally I saw that because she's such a sedentary person. ഒരു അനക്കമൊന്നും ഇല്ലാത്ത കാരണം it's absolutely like her abdominal wall was probably this thin. There's no muscle. It's just a skin. And there's a layer called the rectus sheath. അത്രേ ഉള്ളൂ, വേറെ മസിൽ ഒന്നും എൻ്റെ ഇടയിൽ ഇല്ല.
Okay.
Which is actually very bad.
Yeah. I mean, they should
at least work out അല്ലെങ്കിൽ some amount of physical
activity.
ഇപ്പോൾ അതിന്റെ ചൂടത്തായിരുന്നു ആരും പുറത്തിറങ്ങി നടക്കില്ല. But I think just walking itself makes a big difference.
It does. They say like
recently when me and my wife we were traveling.
Right.
We walked about, as I was telling you earlier, we were walking about 10 to 12 kilometers every day for almost 2 weeks. and we were lavishly eating, drinking from morning onwards. But we actually sort of lost weight. I mean,
You do.
weighing machine വ്യത്യാസം വന്നില്ല എന്നാലും you can feel your clothes.
ശരി, ട്രാവൽ ചെയ്യുമ്പോൾ പ്രത്യേകിച്ച് പോലെ യൂറോപ്പിലൊക്കെ പോയി കഴിഞ്ഞാൽ യു ഡോണ്ട് പുട്ട് ഓൺ വെയിറ്റ്.
Yeah.
നടന്ന് ഉള്ളത് പോകും. എത്ര തിന്നാലും വെയിറ്റ് വയ്ക്കൂല.
So that's when it really hit me, like walking. Workout is like walking, just being active. So if you on your phone, if you can observe your step count.
Yeah.
Minimum 15,000 step count ഒക്കെ ഉണ്ടെങ്കിൽ you will easily lose weight. You'll
get
into a better shape. Working out is, again, if you are interested in athletic career, this is one friend of mine. She was a junior in college. She's in Cochin now.
Right.
So she got into fitness, and this is a point where I was not working out. And all the Insta reels ended, and then I joined this
got inspired
and started going. And then she got pregnant. Throughout her pregnancy, she was working out, weight training, functional, everything. And after delivery, I think within few months, so she was bringing her child as well to the gym.
Okay.
She's working out. I mean, these are things of women that really.
Yeah, that's inspirational stuff. That's like boss babe stuff, basically. Like
that's amazing. I've got utmost respect for that.
Yeah.
See, my wife also, Alum, she's far more fit than me. I mean, she gets more active than me.
Okay.
She's the one who's been pushing in. After a long while,
she runs.
She runs and she does
marathon something. Right.
Yoga. She does yoga and she goes to this body fit thing.
Okay.
She's active. She's a little more conscious. Yeah. I don't look at the
right.
I just eat. If it's tasty, I eat it, and sometimes I go a little overboard.
Okay.
So after finally she pushed me, and both of us went to a new gym. And
okay.
After a long while, I worked out. I was like, okay, now I can feel these specific muscles here and there. After a long time.
Yeah. I do like combat stuff. So I've seen it. Yeah. So that's like, for me, the whole working out bit is it shouldn't get monotonous.
Yeah.
Like if you do only weight training, only സംഭവം ചെയ്ത് കഴിഞ്ഞാൽ ബോറടിക്കും. So if you mix it up, and the reason I do the combat thing is because I like boxing as a sport. So it's like ചെയ്യണേന്റെ കൂടെ you're kind of learning something as well.
It's a new skill that
you're acquiring a skill as well. So there's a certain fun aspect in that. Yeah, there's a certain fun element to it.
Where we are going again is like a mix of functional training and weights, and it's not exactly machines. There are dumbbells and barbells, and then you've got all these ropes and balls and things and
right.
Sledges.
Yeah, the sledges. Yeah.
So it's interesting. It's not just building muscle. Our flexibility and the mobility is a big.
Mobility, actually, yes.
As you grow older.
As you go older.
You said,
yeah.
Your volleyball experience.
Yes. That is again mobility korvana. And I was on the beach. My body without any warm up, like. നമ്മുടെ പ്രായമാണെന്ന് പറഞ്ഞാൽ I started playing volleyball with a bunch of young kids. Next thing I know, my shoulders dislocated.
Same thing. If you're not used to the sort of mobility on a daily basis, good workout, just weight training മാത്രം ചെയ്താലും കാര്യമില്ല.
You heard about the recent incident, the Panampally Nagar one? The girl was the baby thing. What's your take on that? I mean, like,
it's very shocking.
Right.
The fact it happened in Cochin. I mean, നേരത്തെ പറഞ്ഞ പോലെ people are more literate and
you assume they are a little more aware.
Yeah, so, I mean, I've heard such things in Pondicherry when I was doing my PG.
Okay.
So എൻ്റെ കോളേജിന് അടുത്തായിരുന്നു ജിപ്മ, one of the biggest colleges there. അപ്പോൾ അവിടുത്തെ ഓരോ സ്റ്റോറീസ് ഈ പറഞ്ഞ പോലെ I've heard people just walking in, അവിടെ ഹോസ്പിറ്റലിൽ ടോയ്ലറ്റിൽ പോയി ഡെലിവറി ചെയ്ത് ബേബിനെ അവിടെ ഇട്ടിട്ട് പോകും.
Okay.
And that's a huge campus. അവിടെ you may not even see that.
Right.
It's literally like ഒരു ഫോറസ്റ്റ് പോലെ ഒരു കോർണർ ഉണ്ട്, അങ്ങനെയൊക്കെ ആയിരിക്കും. ആൾക്കാർ ഇങ്ങനെ പോയി ചെയ്യും. I think we've had a patient in my college where എന്തോ വയറുവേദന എന്നൊക്കെ പറഞ്ഞു വന്നതാണ്. She was already like some 6-8 months pregnant. She never realized that she was pregnant.
Okay.
Other illiteracy. I'm just saying that ignorance about pregnancy or ignorance about all these things. നമ്മുടെ നാട്ടിൽ ഇത്ര എഡ്യൂക്കേറ്റഡ് ആയിട്ടുള്ള ഒരാളിങ്ങനെ what happened is really sad. Sexual activity amongst
kids,
teenagers. It's, as we discussed earlier, it's always been prevalent. It's always been there.
It's always been
anywhere
there
in the world. But നമ്മുടെ നാട്ടിലത് ഹഷ് സംസാരിക്കില്ല. So there's a lot of ignorance associated with sexual activity as such, and the safety, the implication. These പിള്ളേരും they're not aware. You might think with all internet and YouTube and everything, people might be aware, but they're not.
But that's a lot of misinformation as well, no?
A lot of
A lot
misinformation.
of misinformation as well from the internet.
True. Everything is sexualized.
Yeah, everything is overly sexualized now, if you ask me. Yeah.
So that's also a problem. They're not aware, like contraception. Whether you can stop them having sex, I don't know. That's not in our control.
I don't, yeah.
And that's depending upon their thing. Our idea will be, but then at least things they should look after.
Create an environment where people can actually talk about it.
Exactly.
You know, at least at home. That our education, like instead of most of the people I know have gotten, a good amount of them have gotten their sexual education from porn.
Yeah. That's
from watching porn. And that's the worst way to get sexual, because it is one of the most inaccurate depictions.
Absolutely.
Yeah.
Parents, in that situation, from what I understood, was the parents were never aware that she was pregnant.
Which is, I'm surprised. Like,
they didn't know about the delivery. It seems apparently they were amongst the crowd that gathered around the baby's body. So it's funny how that happened.
Yeah, I mean,
like another thing is, so we get patients where with these huge fibroids and things like that, and nobody's noticed, and girl thought that she has put on weight. And, so one thing is, so now kids are like, they want their privacy, this and that. Panda generation, my dad used to talk about this like this. So how your parents are always aware of the changes that is happening to their physical changes happening to their kids. You see them changing clothes, and everything is a little more out in the open. Privacy
Western concepts.
I mean, there are good things and bad things. Privacy is important, but then parents are also not seeing anything. So probably that's why the parents are not aware of her pregnancy.
Yeah, but carrying a baby to term and then
at least she should have told someone.
Yeah, I mean,
there are a lot of these helplines and a lot of things available now.
Right.
If you Google it, you'll probably find those numbers as well.
Yeah.
She could have taken help from somebody. She could have. How old was she? I'm not sure. They didn't mention the age, I think.
I think early 20s is. 20. I think early 20s is what.
She's old enough to. Figure things out. She could have taken some sort of help.
Right.
At least she can go see a gynecologist on her own.
But apparently, I think she. I don't know. I'm not sure the exact news. I think she went and they denied the abortion, and then I think she was left without avenues.
Out of rape is what I've understood in the newspaper.
Okay. Oh.
And see, multiple places where they provide help.
Right.
The kind have done something, and even in newspaper you'll see Asanam court order. So normally your medical termination has to be legally allowed is about 20 to 24 weeks. That's situations where the pregnancy out of rape or the child has some severe abnormality. Finally court you get permission.
So we've had another situation like at our center. My mom was telling that we had a patient come in. The girl was 13. Okay, the girl was 13. She was bought by her parents. The boy also had come. Boy's family as well.
Wow.
He's also of similar age. Okay. They're both studying in school, and she was pregnant. Wow. But the boy's father was insistent that he be there to watch the entire thing. Like he be there throughout this entire thing. They got the abortion, obviously. But the boy's father, I found that remarkable. I'm like, wow, okay. I mean, it's not that like, the girl goes through the whole thing. The fact that his parents insisted that he also be there. And they actually obviously, they discussed it with the family, and then it happened. It was a difficult episode for them. But then, but the thing is, the number of cases of young girls coming in with unwanted pregnancies has gone up significantly. And I think if a US if a girl attains, once a girl hits sexual maturity, once she hits puberty, the parents usually put her on birth control.
Yeah.
നമ്മുടെ നാട്ടിൽ അതില്ല. I mean, ഇവിടെ ഇപ്പോൾ oral contraceptives മാത്രമേ ഉള്ളൂ, like a morning after pill. What is the difference between a birth control and like a morning after pill? Like, is it?
So birth control pill is like a regular packet will contain like 21 tablets.
Okay.
So you have to take it from your second day of your cycle continuously. So you take for 21 days.
Okay.
You'll get your next cycle.
Okay.
Again, you restart the whole packet
Okay.
again.
Okay.
So if you're taking it properly, again, you shouldn't miss tablets as well. So I'm gonna
Okay.
regularly your
Okay.
your contraception is there. You won't get pregnant.
Okay.
I mean, any method has got its own failure rates.
Okay. Yeah, of course.
This is what it is. And then the morning after pill or these emergency pills,
Right.
it has a very high failure rate.
Right. Right.
So basically, you have to take the tablet within 72 hours of the sexual activity.
Okay.
It has a very high failure rate. We've got many patients with that.
Right. Right. Right.
It's a known thing. Nalla high failure rate ullada. So morning after pill is usually a very bad idea.
Okay.
To depend on emergency pill.
Okay.
Simplest thing you can do is use a condom. So it prevents spread of any infection.
Yeah. Yeah. The safest method.
Prevents pregnancy as well.
Right.
I remember back in college there was an article in the newspaper.
Right.
I think government came up with a thing where they'll put condom vending machine.
Right.
So as a trial, I think Trivandrum evideyo
Vachu.
Keralathil ende orma. And then there's a lot of uniform wearing kids taking condom from it. Adoda nirthi. That's really
But that's the
stupid.
exactly
Exactly.
That is the exact. It's counterproductive, right? Other than I mean, the fact that kids.
When it becomes easily available, at least they'll use it.
This comes back to the same thing. Like our problem is not that kids are having sex. The problem is our failure to address that.
Exactly. That's the problem.
It's like that is very counterproductive.
That was really stupid is what I feel. See, abroad you'll get condoms available like even airport railway station toilets you'll see these vending machines.
Right.
At least people will use it.
From what I've seen is we live in a very repressed, sexually repressed society.
Married couples.
Right.
Like, this is not something they discuss or sometimes they don't realize they have a problem because it's not discussed.
Yes.
See, a lot of these infertility issues come from some sexual problems. See, a lot of patients come to us after years of marriage.
Right.
Because they don't talk to another person about this. They're like a repressed topic at
It's a taboo subject. Right from the get-go, it's a taboo subject.
And it's not like all parents tell their kids what to expect after marriage and, about sexual activity, things like that. Even for that matter, I remember during my post-graduation in college, so you've got labor room duty. And women, they're screaming and, in labor. Right. Absolutely normal.
Normal thing, yeah.
Normal thing. So I was talking to one of the patients, asking, so it looked like she was completely unaware of what was happening. Okay. I asked her, you're about to deliver. Did your mother or somebody tell you what to expect or, this is how it's going to go?
Right.
She was not told anything.
Oh.
I mean, the community there where our college was it's more like a fisherman crowd and education level this doesn't require education.
Even in educated communities, even in the cities, the metros, the conversation around all these topics is very little. It's still considered taboo. Yeah. It's still considered very private. And our even between spouses, the open communication open communication is very less.
True.
And we live in a very squeamish society. It's like, when I was doing my MBA in Chennai, the boys and the girls wouldn't sit together. It was, the boys on one side and the girls on one side.
Yeah.
And, I always wonder, you have to go work in a mixed environment. MNCs don't care if you're a boy or a girl. They're going to put you in a team.
Yeah.
You have to work in a mixed gender environment. You need to learn how to mingle with the other gender. So, the more you mingle, misconceptions and myths
schools, parents, same way.
Yeah.
You're not supposed to talk to another boy, you don't, mingle with them. And suddenly after marriage, you go sleep with them.
That's first day. Now go sleep with them.
Yeah, so it's a shock for some women or for some men.
Yeah.
They're probably very socially awkward as well. They don't know how to approach the opposite gender.
Social awkwardness is massively there. If you look, Indians have a very bad name in the international community, especially the whole send bobs and veggie meme. It's like Indian men have a very poor image abroad. Like, because if you ask any Indian man, what is your ultimate goal? Get a white bride.
Yeah.
Go to.
They probably wouldn't have had any exposure to the
ഇല്ല
opposite gender.
ഒന്നുമില്ല സംസാരിച്ചിട്ടുള്ളൂ.
Suddenly you're free to talk and do whatever you want.
Exactly. So I feel we should, as a society, we should loosen up.
Yeah.
Physical as well. It affects your personal, as a society, as it affects your health as well. The more relaxed and the more communicative we are, I think
you're at peace.
Yeah, exactly. You're at peace. And especially I've seen this among some couples. When you don't openly talk and you start bottling stuff up, it turns bad. Like mentally, it turns bad. Even among my friends also. Like I try and tell them, like, there's no judgment. I mean, we might rip on each other.
Yeah.
That is in jest.
Boys being boys.
Yeah, there's boys being boys. But the thing is, if you genuinely are feeling something, if there's a problem, just talk. Just always just feel free to talk. Like that mental health aspect. That's another thing which needs to be worked on.
Absolutely.
Yeah, both men and women.
True. I mean, again, there's a lot of taboo associated with it.
Yeah.
Seeing a psychologist or a psychiatrist.
Okay.
Sometimes when I suggest that to our patient, psychiatrist
right.
There's a lot of that hesitancy in there.
Yeah. It's
you just go talk to them. You might feel good just opening up to another person.
Yeah.
You may not want to talk to your partner. Maybe just
a non-judgmental third person who doesn't know anything about you.
Just let it out.
Yeah.
And sometimes they'll put things in a different perspective, and then probably it's all things that you know. But then a perspective, you're like, okay, that makes sense.
Yeah.
But couple counseling is also something I think every couple should undergo.
Yes.
Irrespective of how long you've been married, or me and my wife, we've done counseling. This is one thing during COVID. So one of our friend, part of a church, they had this once a week couple group counseling sort of thing, like classes basically.
Okay.
So I was like, this is like was the sort of turning point for me. Like blah blah blah. I was not too interested, and then because this friend was insisting, we went and tried. So it was like COVID time, lockdown. Every Sunday evening, 1 hour.
Right.
So each day, somebody would sort of do a class and sort of interactive question answer. You'll give a small work where you have to talk to your couple, to your partner, and
they gave you like activity exercises kind. Okay.
When somebody else tells you things in a slightly different perspective,
it's a fresh perspective, right? It's a third.
Especially, I think for men. Normally, we are not all of them, but then പെണ്ണുങ്ങൾ ആലോചിക്കുന്ന പോലത്തെ ആ ഒരു ഇമോഷണൽ ലെവലിലോ അല്ലെങ്കിൽ ആ ഒരു ഇതിൽ ചിലപ്പോൾ ആലോചിക്കുന്നുണ്ടാവില്ല. സോ ഫോർ മെൻ ടു അണ്ടർസ്റ്റാൻഡ് തിങ്സ് ഈ പറഞ്ഞ പോലെ ഒന്ന് വേറെ എന്തെങ്കിലും രീതിയിലൊക്കെ പറഞ്ഞു തന്നാലേ ചിലപ്പോൾ മനസ്സിലാവുള്ളൂ.
അത് മാത്രമല്ല, the other thing is evolutionarily, if you look at it, women heal in groups. Men heal alone. Okay, we are not designed to heal in groups. Women, they talk about their problems with their sisters, their friends. They talk about it. They heal together. They heal in groups. That's how they define. Let's go out, girls' night out, or do that kind of stuff. We would rather sit and brood over it. Right. We would rather sit.
You don't want to show off your weakness as well.
There's a bit of that. There's a bit of the fact that vulnerability. It's that if we expose our weakness, we show ourselves to be vulnerable, and hence we are susceptible to more damage. Or ingata kore sambhavangal undu, misconceptions undu. Generally, this therapy, like it has a much higher failure rate with men than women. Like men tend to drop off more.
True.
Especially speech. Let's talk about it. Sambhavandalo that men.
It's a lot of effort for men.
Satyam. Personally, at least this is for me. If I've had a bad day at work, okay, ended to VT to talk about it, it's kind of like mentally I'm reliving that whole thing again. I don't know about you, like it's
not just doing. See, what was wrong? I don't know really.
I don't know exactly what exactly went wrong.
So for women, I don't know, they have this, അങ്ങനെ ചെയ്തിട്ട് ഇങ്ങനെ പോയപ്പോ അങ്ങനെ സ്റ്റോറി ഇത് for us
എവിടെയോ എന്തോ ശരിയായില്ല എന്തോ എന്തൊക്കെ
feeling, and so to figure that out, to talk about it.
But you have to actually figure out what went wrong. You do need to talk about it.
Yeah.
You do need to ഒരു ബാക്ക് ട്രാക്ക് ചെയ്യണം. അപ്പോഴേ നമുക്ക് ക്ലിയർ ആയിട്ട് മനസ്സിലാവുള്ളൂ എവിടെയാണ് തെറ്റ് പറ്റിയെന്ന്.
ഇരുന്ന് സംസാരിക്കാൻ തുടങ്ങിയാൽ ഇത് പതുക്കെ വരുവുള്ളൂ. അല്ലാതെ നമ്മൾ ആലോചിക്കുന്നൊന്നും നടക്കില്ല. That's the thing, like when you sit and talk, ഒരാളുടെ അടുത്ത് സംസാരിക്കുമ്പോൾ തന്നെ you might feel better.
Right. Yeah, true.
Mental health is something that needs to be addressed.
ഇപ്പോഴും ഉണ്ട്. There's still solid stigma around it, like what you said, you know.
I've seen is I think after COVID, a lot of these psychologists, a lot of online services available.
Right.
So for people who are a little hesitant, going to a hospital, see if somebody else sees you in front of that psychiatrist, psychologist office room waiting, ഒരു മടി ഉണ്ടാവും. അയ്യോ ഇവരെന്നെ നമ്മളെ കണ്ടു, തിങ്കിങ് അങ്ങനെ ആലോചിക്കും. അപ്പൊ ഇതിപ്പോ ഓൺലൈൻ ആണ്, യു ക്യാൻ ഡു ഇറ്റ് അറ്റ് യുവർ ഓൺ കംഫർട്ട് ലെവൽ. This whole for some friends and patients that have recommended this, അവർക്കൊരു മടി ഉണ്ടായിരുന്നു. ഈവൻ എനിക്കും ഇനീഷ്യലി ഒരു മടി ഉണ്ടായിരുന്നു. നമ്മള് യു നോട്ട് സീയിങ് ദ ഡോക്ടർ ഓർ ദ സൈക്കോളജിസ്റ്റ് ഇൻ പേഴ്സൺ. അപ്പൊ ഇത് ശരിയാവോ എന്നുള്ളൊരു but then actually online,
I haven't tried the online. I haven't tried.
It's a little more flexible, timing wise ഒക്കെ നോക്കിയാ. They generally have it in like, morning hours before work or evening. So അങ്ങനത്തെ ഒരു flexibility, and again probably depends on the psychologist as well. But I think availability of online counseling sessions, it's quite good for a lot of people. Some of patients from abroad, Allu patients, Canada, അവിടെ if they want counseling, നമ്മൾ ഇവിടുന്ന് പോകുന്നവർ കുറെ റെഗുലർ ആൾക്കാരായിരിക്കും. അവർക്ക് അവിടെ പോയി കൗൺസിലിംഗ്, സ്പെൻഡിങ് hundreds of pounds on counseling. പറഞ്ഞ പോലെ കൗൺസിലിംഗ് is not considered treatment. അപ്പോൾ അതിന് whether it's worth spending so much എന്നുള്ള ഒരു സംശയം. അങ്ങനെയുള്ളവർക്ക് ഈ ഓൺലൈൻ സർവീസസ് in India is a big help. I think in like offices also for കൂടുതലും there's more.
They are mandating it more. പക്ഷേ that is also a bit of കുറച്ച് brownie points കുറച്ചൊന്നും ഒരു
at least എന്തെങ്കിലും something will be picked up.
Yeah, something is better than nothing.
Yeah.
The reason there was a study that doctors are the most stressed out, or IMA did a study, no?
There's absolutely no such things amongst the
doctors are the worst people to take to a psychologist. സത്യം പറഞ്ഞാൽ
ഡോക്ടേഴ്സിന് എല്ലാം അറിയാന്നുള്ള ഒരു sort of wrong misconception ഉണ്ട്.
Exactly, there's a lot of unlearning to be done before they can be studied. Doctors are order എനിക്കെല്ലാം അറിയാം. And I think a good amount of doctors still consider psychology as pseudoscience, not psychiatry. I think psychology as I mean you're of a younger generation.
I think this is quite a good thing. Like, but I've seen my dad referring patients to psychologists where patients ചില സമയത്ത് they may not have any specific, so for that matter, my grandmother, I think all their peers and everyone, most of them have passed away. They're sort of alone. This is the time I think they were staying alone in their house in Angamali. We are in Cochin. My dad's brother is also in Cochin. But they were self-sufficient, living properly. But then പറഞ്ഞ പോലെ അത് അവിടെ വേദന ഇവിടെ വേദന അങ്ങനെ ഓരോന്നൊക്കെ പറഞ്ഞിങ്ങനെ ഇരിക്കുകയായിരുന്നു. Took them to multiple doctors. I think it was my grandmother. ഒന്നിനും ഒരു relief ഇല്ല. Finally, somebody suggested take her to a psychologist.
How old was she when she went?
Probably in her 80s.
Okay.
I mean, she was healthy and വേറെ കുഴപ്പമൊന്നുമില്ല. പക്ഷേ she's got, like any, she's diabetic and,
I mean, she's 80, obviously. എന്തെങ്കിലുമൊക്കെ ഉണ്ടാവും.
അപ്പോൾ she had this pain on her leg. അപ്പോൾ നമ്മൾ വാസ്കുലർ സർജൻ ഇവരെല്ലാവരെയൊക്കെ കാണിച്ചൊന്നുമില്ല. അപ്പോൾ അവസാനം സൈക്കോളജിസ്റ്റ് സജസ്റ്റ് ചെയ്തു, കൊണ്ടുപോയി കാണിച്ചു. ആൻഡ് ദെൻ ആഫ്റ്റർ സ്പീക്കിംഗ് ടു സൈക്കോളജിസ്റ്റ് ദെൻ ഷി വാസ് ആക്ച്വലി ഫൈൻ. അങ്ങനത്തെ കുറച്ച് എക്സ്പീരിയൻസ് കഴിഞ്ഞപ്പോൾ ഞങ്ങളും ചില പേഷ്യൻസിനോടും some of them very happy. കഴിയുമൊക്കെ വേറെ മേജർ പ്രോബ്ലം ഉണ്ടാവില്ല. just need some reassurance and doctors or specialist, gynecologist or ENT അല്ലെങ്കിൽ ophthalmologist, they may not be good at counseling. So it's always better to send them to a professional person to counsel the patient. Nowadays a lot of these hospitals will have, like, even infertility സ്ഥലത്തും എല്ലായിടത്തും there'll be a counselor to
now it's mandated. You need which is good.
The doctor can't do everything.
the fact that we still have such a limited understanding of the thing, like, because it's the brain, right? It's basically, your brain is one of the most complex organs in your body. Like it basically,
ways that you can't imagine.
Exactly. Like, and the influence the brain has on the rest of the body is significant. Like,
Absolutely.
You cannot even if you're healing from a physical ailment of something, if your brain doesn't help with that, it is not going to happen, right? But the thing is, ഇത്ര ഒരു കോംപ്ലക്സ് ആയിട്ടൊരു ഓർഗൻ ആയിട്ടും our understanding of its actual function is still at least ഒരു ജനറൽ പോപ്പുലേഷൻ്റെ അടുത്ത് ഹാർട്ട് എന്നൊക്കെ പറഞ്ഞു കഴിഞ്ഞാൽ ഉടനെ തന്നെ പേടിയാണ്. ഓക്കെ, ഹാർട്ട്, ലിവറിനെ പറ്റി അത്യാവശ്യം, കിഡ്നി, ലിവർ ഇതൊക്കെ പറഞ്ഞു കഴിഞ്ഞാൽ ഉടനെ പേടിയാണ്. പക്ഷെ ബ്രെയിൻ എന്ന് പറയുമ്പോൾ അത് കുഴപ്പമില്ല. അല്ലെങ്കിൽ
ഇപ്പൊ ഒരു സൈക്കാട്രിസ്റ്റിനെ കാണണമെന്ന് പറഞ്ഞ അയ്യോ വട്ടെന്നാണ് അതിന്റെ ഒരു
അത് വാക്കതാണല്ലോ.
people don't realize, just like your hormones, you're having certain problems because of sort of chemical imbalance.
ഹാർട്ട് ഇഷ്യൂ വന്നാൽ നിങ്ങൾ കാർഡിയോളജിസ്റ്റ് അടുത്ത് പോകും. അതുപോലെ ബ്രെയിൻ ഒന്ന് വീണ്ടും ഡോക്ടറിന്റെ അടുത്ത് പോകണം. There's nothing wrong in that. അതിന് വട്ടല്ല.
Happens because of some sort of chemical imbalance. ഇത് ആരുടെയും തെറ്റല്ല. This can happen to anyone.
Exactly.
A completely normal person as well.
Yeah, but our understanding, it's a good thing that people are talking about it right now, but we still got a long way to go. So what plans next? I mean, as far as the hospital and you career-wise, any?
So I'm still trying to figure out. There's always a comparison with my dad. So I'm trying to figure out a way that I can do something new,
Right.
Which is probably different from what he's doing.
Okay.
So I don't know. There's in laparoscopy there's robotic. Just already becoming pretty common.
There are multiple centers, right? Yeah.
That is something that both me and my dad has been thinking about, but financially it's a very it's a huge investment.
Right.
So that is something. And then now this whole new thing is aesthetic or cosmetic gynecology.
Yeah.
So that's also a new thing, but it's a very it's a difficult subject or difficult stream to go into, especially with the sort of patients that you deal with.
Yeah, that's one thing which I've heard. So even we've been considering dabbing into that. Okay. But the thing is, your wife would know this actually. The patients who generally seek out these cosmetic surgeries, they already suffer from a bit of body dysmorphia.
Yeah.
Mentally.
Exactly.
Okay. It's like, ചുരുക്കി പറഞ്ഞു കഴിഞ്ഞാൽ ഒരു പേഷ്യൻ്റ് വന്നിട്ട് ആക്ച്വലി ഡോക്ടർ ജീവി ടോൾ മി ദിസ്, he was just telling me this, ഒരു പേഷ്യൻ്റ് വന്ന് എൻ്റെ മൂക്ക് ശരിയാക്കണം എന്ന് പറഞ്ഞു. മമ്മൂട്ടിയുടെ മൂക്കാണ് ഗോൾ. ആ ഡോക്ടർ എത്ര സർജറി ചെയ്താലും ആ മൂക്ക് മമ്മൂട്ടിയുടെ മൂക്ക് പോലെ ആവൂല. കാരണം ആ മൂക്ക് മമ്മൂട്ടിയുടെ മുഖത്തിരിക്കണ മൂക്കാണ്. അതും ഞാൻ എത്ര സർജറി ചെയ്താലും മമ്മൂട്ടിയുടെ മൂക്കാവൂല. പക്ഷേ കുറച്ച് എന്നാൽ കഴിയുന്ന എന്തെങ്കിലും ചെയ്യാൻ പറ്റും. പക്ഷെ അത് എത്ര ട്രാൻസ്ലേഷൻ ബേസിക്കലി ലൈക്ക് എത്ര ചെയ്ത് കഴിഞ്ഞാലും ഈ പേഷ്യൻസിന് ഇത് എത്ര സാറ്റിസ്ഫാക്ഷൻ. സോ that's one thing, like at my center also we discussed and I was like, these patients need a great amount of counseling. Absolutely. And before doing this kind of ചെയ്ത് കഴിഞ്ഞിട്ട് അവസാനം no, I didn't like it, and then no, because I want a refund or this, they did this, that's not a good way to go about it.
These plastic surgeons, everybody, they take a lot of these before and after picture, to make them understand. അല്ലെങ്കിൽ ചിലപ്പോൾ സർജറി കഴിഞ്ഞിട്ട് അയ്യോ ഇത് ഒരു വ്യത്യാസമില്ല ഇങ്ങനെ കാണിച്ചു കൊടുക്കാതെ, and some of these changes you may see the difference only after months.
Right.
സർജറി കഴിഞ്ഞാൽ ഹീൽ ചെയ്ത് ഇൻഫ്ലമേഷൻ ഒക്കെ മാറി കഴിഞ്ഞാൽ കാണുമല്ലോ. അപ്പൊ ഈ ഗൈനക്കിൽ I think it's even more complicated. Again, ഈ പറഞ്ഞ പോലെ patient satisfaction or what they want എന്നുള്ളത്, if we can't give them 100% of what they want,
right,
again there's a point of dissatisfaction.
True. I mean,
otherwise when you're doing surgeries, it's a disease and we are treating it, we are clearing it.
Because this is tied to aesthetics, it is aesthetics, and it's heavily tied to your self-esteem.
Exactly. And everybody has a different definition of what is perfect.
And that constantly changes, especially because of Instagram and everything now. That constantly changes, like the trend,
the filters and
all the filters, and even the surgeries, like even till apparently till a little while back, the Brazilian butt lift, that was fashionable, but that has gone out now, it seems. So imagine all the people who did that.
The beauty keeps changing. How size 0 is a thing, And then, whole curvy body is a thing then, and now back to...
Now back to, it's fashion. It's basically, it's become like fashion, It just keeps rotating, it keeps circling around. So imagine all the people who did the Brazilian butt lift. Now what are they going to do, like remove the filler? I don't know how does it work. So, yeah, but I mean, toxic effect of social media, I suppose.
Yeah.
One of the downsides.
And mainly because body dysmorphia ഉള്ളവർക്കാണ് ഒരു main ഒരു issue വരുന്നത്.
Right.
At the same time, cosmetic gynec എന്ന് പറയുന്നത്, it's not purely cosmetic. There are certain things like there are these laser equipments used. അപ്പോൾ അതില് for women having urinary incontinence, urine leak ചെയ്യുന്ന problem, അതിനൊക്കെ is usually a surgery associated with it. So with these new things, ഈ laser ഇത് വെച്ചിട്ട് it's shown a certain level of success.
Okay.
May not be as effective as surgeries, but then for women who doesn't want to undergo a surgery, this is a non-invasive method of doing things.
Oh,
so there are these non-cosmetic things also associated with it.
Okay, correct. I mean, this urinary incontinence in the area, you were talking about that. Like, at what age group does it affect, or is it?
It can happen from any age group. I know one of my friend, so she's in her 30s.
Okay.
After delivery, she has this problem.
So because of a weakening of the muscles, is it? Or?
Yeah, generally a weakening of the muscle, and basically our bladder, neck and mobility. Our muscle weakness is generally following delivery as you grow older. These are the usual situations. Depending upon the symptom, like the severity. I think for any women, severe cough, leak. But a normal cough or normal sneeze, for some, I've had patients where they said, I can't do jumping jacks.
Okay.
Every time she does a single jumping jack, she's leaking. Or for some women, chair in any kimo.
Okay.
Joke chiricha. These are all like a problem. Again, these are all like sometimes taboo topics. Nobody talks about it. This normal ആണെന്നുള്ള sort of എല്ലാ പെണ്ണുങ്ങൾക്കും urinary leak ഉണ്ട്. So it is normal. ഇതൊന്നും ചെയ്യാൻ പറ്റില്ല അല്ലെങ്കിൽ ചെയ്യേണ്ട ആവശ്യമില്ല എന്നുള്ളൊരു sort of misconception ഉണ്ട്. So we get patients sometimes after a long time. Some people are aware and they come to us. But generally women, priority becomes the family and other things. സ്വന്തം their health.
Yeah, neglect again comes down to this. It comes down to that. Pay attention, love. Self-love.
Yeah.
Self-love has to be there. George, thank you so much for coming.
Thank you for having me.
Finally, we got around to doing it. Having this talk.
It's my first time doing this, and I think it was good.
Yeah, it's good. You should. Like, see, you guys should talk more, like especially doctors who are in positions where you can bring about change and bring about influence to the general public. You have a lot more to add to this world, and I think you guys should talk more. And there's a whole lot of misinformation on the internet. Actually qualified ആയിട്ടുള്ള ആൾക്കാർ സംസാരിച്ചു കഴിഞ്ഞാൽ ഇത് മാറുള്ളൂ. അപ്പോൾ rather than influencers, like ഒരു ഗൂഗിൾ സെർച്ച് ഇൻഫർമേഷൻ വെച്ചിട്ട് ഡയറക്റ്റ്ലി ഇൻഫ്ലുവൻസർമാരുടെ എഴുതി വെക്കുന്നത്, better than that is I think you guys should put yourself out there, talk, and I'm not saying become an influencer yourself, but just spread the message, spread the information.
This whole way of having a casual
exactly.
It's good. I mean, it puts the person at ease and
at ease.
No, you kept saying that relax, don't worry.
Yeah, obviously. I mean, it's not an interview. It's just discussing, touching whatever topics you want. That's the thing. And thank you so much for coming.
Thank you.
All right. Maybe we might do another episode someday, and we could love to have you on board again.
Definitely.
Okay. All right, doctor. All right.